Lutheran Senior Services exists to help older adults live life to the fullest. They carry out this mission through the care and facilities they provide. In the last few years, Lutheran Senior Services reworked their post-acute care program to increase efficiency and improve outcomes.
Lutheran Senior Services made a commitment to be an elite provider in the post-acute care arena. And so it began to invest not only in the clinical practice, but also in the recruitment of professionals that would help us raise the bar, not only for ourselves, but perhaps for the industry and our markets. LSS was willing to take a risk and to kind of be an early adopter of what's now called Model 3 bundled payment.
This commitment resulted in REACH, a post-acute care program that meets or exceeds the standards of the Model 3 Bundled Payments for Care Improvement Medicare initiative.
There is evidence that demonstrates that less expensive care is better care. In other words, we're treating the person at the right time, at the right place, in the right environment. We don't use a cookie-cutter approach. We do have defined care plans and defined care services for each individual and their diagnoses.
Dr. Walter Lynn, physician advisor for Lutheran Senior Services, along with his colleagues at Generation Clinical Partners, was instrumental in improving post-acute care.
What we've done is created a medical model that is characterized by consistent physician presence and engagement in the post-acute setting. So we are at our facilities on a daily basis, as opposed to historically in the setting, physicians are only at the facility half day a week, sometimes half day every other week. We, through our medical presence, work closely with therapy to maximize the benefit that they receive from their daily therapy sessions. So for example, if a patient with congestive heart failure or COPD is short of breath, that often impedes their ability to really receive their maximum benefit from their therapy sessions. To the extent that we are able to treat their shortness of breath effectively, or for example, control their pain effectively, that increases their ability to participate in therapy, increasing the value of each therapy session and shortening the length of stay because they're able to achieve their therapy goals quicker.
Thanks to these changes, Lutheran Senior Services has saved $2.7 million compared to the regional average. Meanwhile, hospital readmission rates have fallen to 10% or less per quarter. LSS saves an average of 22% per episode of care, while other bundled payment providers average between 8 and 10% savings. The Signature Healthcare Foundation awarded Lutheran Senior Services the 2016 Senator Paul Simon Award for their outstanding work in cost-saving innovations.